The purpose of this video is to try and simplify oral antibiotics. As we know, over the last few decades, optometry is becoming more and more medically oriented, and so this is an opportunity that we have to serve and benefit our patients through understanding oral antibiotics. I was going through an article from Review of Optometry called When a Drop Isn't Enough. This article, I really liked it. It broke down simply what drugs are the drug of choice for different circumstances. The article stated that most infectious ocular conditions can be treated with 5 oral agents. So that's really comforting to know. In second year, we learned so many different drugs, it was hard to keep it all straight. But I feel like if we know in our heads there's 5 that can treat a majority of these infectious ocular conditions, that can give us confidence to build a foundation and move forward from there. So let's talk about these 5 different drugs. The first is Augmentin, which is a combination of amoxicillin and clavulanic acid. It is the drug of choice in children with acute soft tissue infections, such as hordeolums, preseptal cellulitis, dacryocystitis, and dacryoadenitis. It should not be used in patients that have a penicillin allergy, and it is contraindicated in patients with liver disease. The specific dosing for pediatric patients with Augmentin is 20 milligrams per kilogram a day up to 40 milligrams per kilogram a day for no more than 10 days. At the very end of this video, I will explain how to calculate milligrams per kilogram so that is a little bit more clear. According to the article, anytime we treat children, we always call their pediatrician as a courtesy and send a follow-up letter. And this has been proven to be a great practice builder, frequently resulting in referrals. For adults, the dosing is 500 milligrams to 875 milligrams twice a day for 5 to 7 days. This drug should be taken with food or milk for better absorption. The second drug is cephalexin, brand name Keflex. This is very similar to the first drug, only now it is the drug of choice for adults with soft tissue infections. The specific dosing for this drug is 250 milligrams to 500 milligrams 4 times a day for 10 to 14 days. It should not be used in patients that have a penicillin allergy as well, and it is contraindicated in patients that have a bleeding disorder due to the vitamin K interaction. So we've only gone over 2 drugs, but I feel like those 2 drugs have already covered a large population of patients with infectious ocular problems. The third drug that the article talks about is doxycycline. Doxycycline is the drug of choice for chronic infectious disease. It can be used for a lot of different infectious and inflammatory conditions, especially ones that affect the eyelids. It goes into detail about meibomianitis, ocular rosacea, and recurrent corneal erosions. So I'm going to go over the different dosaging for those different circumstances. Meibomianitis, it says consider 50 milligrams twice a day initially for 4 weeks, then 20 milligrams twice a day for 3 to 6 months. For ocular rosacea, it says 50 milligrams to 100 milligrams daily for 2 to 6 weeks should effectively reduce symptoms. Then the medication can be titrated to 20 milligrams per day as a maintenance dose. For recurrent corneal erosions, a dosage of 50 milligrams twice a day in conjunction with topical fluorometholone 0.1% 3 times a day for 4 to 8 weeks is recommended to relieve symptoms and decrease recurrence. Doxycycline should be taken on an empty stomach, which is the first time we've talked about that, to further aid absorption, and it has some unique characteristics. It should not be used in children under 8 or pregnant women, women who are nursing. If there's any chance that the woman is pregnant or could become pregnant, it should not be used. Side effects include photosensitivity and gastric distress. Hopefully I didn't lose anyone on that last one. This next one is pretty simple. So the fourth drug is azithromycin. This is the drug of choice for chlamydial infections, such as adult inclusion conjunctivitis and trachoma. For these disease processes, a one-time cumulative dose of 1,000 milligrams, either 4 250 milligram capsules or 2 500 milligram capsules, should be sufficient. One thing to note that the FDA has advised clinical discretion when prescribing azithromycin to patients with a documented history of cardiac problems. Studies have shown that the drug can cause an elongated QT interval, leading to abnormal heart rhythm and possibly death. The article did not elaborate on that. So the final drug is Bactrim, which is a combination of trimethoprim and sulfamethoxazole. This is the drug of choice if MRSA, MRSA, is suspected. The dosing says it is 80 milligrams to 400 milligrams twice a day for 10 to 14 days. This drug is contraindicated in children less than 2 months of age, pregnant or nursing mothers, patients with sickle cell disease, and those with sulfa allergies. Also, patients may be at higher risk of Stevens-Johnson syndrome while using this medication. I feel like I should mention I'm on my ocular disease rotation right now as a 4th year, and I just saw a patient and she had 3 hordeolums, 1 on the lower lid and 2 on the upper lid. She originally just had the 1, and then it actually, I think she popped it herself, which is not what you're supposed to do, and blood came out and also some pus, and that spread, and the 2 others started to grow. She went to another medical center and was prescribed erythromycin ointment and cephalexin 500 milligrams a day, and also recommended to do the warm compresses 3 times a day. She had done that for a couple days, and it did not appear that she was responding to the treatment at all. We expected some MRSA component to this patient, so we actually prescribed doxycycline 100 milligrams twice a day for 10 days, and also a polysporin ointment 4 times a day for 7 days, and we increased the warm compress use to 4 to 5 times a day. The patient came back 3 days later on a Thursday, and she was doing so much better. She responded to the treatment really well. So maybe we could have used the Bactrim treatment, but I know doxycycline and the polysporin combination worked really well in this patient. As promised, I said I would go over how to calculate milligrams per kilogram per day. So for the first one, which was Augmentin, it was 20 milligrams per kilogram a day up to 40 milligrams per kilogram a day. We're just going to stick with 20 milligrams per kilogram. So let's say we have a child, we'll say he's 6 years old and weighs 80 pounds. I have the math here. It's really simple. You just convert pounds into kilograms, and then from that kilograms, you times that by 20. A child that weighs 80 pounds, convert that to kilograms, which is 36.36 kilograms, and then you times that by 20, which is equal to 727 milligrams per day. There may be an easier way to do this. I think you can contact the pharmacies and they are able to do the calculations themselves. But this is how you would calculate milligrams per kilogram. Special thanks to Review of Optometry for the article they put out there. I basically was just summarizing their own article. The authors were Carl H. Spear and Mark Obenchain, which are both ODs. Hope you enjoyed the video and hope you learned something about oral antibiotics.